Have you been feeling more tired than usual? Maybe waking up in the middle of the night for no clear reason, or noticing your body holding onto water in ways it didn't before? If that sounds familiar, I need you to listen very carefully, because what most people over 55 don't realize is this. Those small, quiet changes may be early warning signs that your kidneys are already under stress. And by the time a routine blood test shows your creatinine rising, a large part of your kidney function may already be slipping away without you ever feeling a clear alarm. I'm Dr. Richard Hale, and I've seen this happen to countless patients, people who felt mostly fine until one day they weren't. The truth is, kidney damage doesn't happen suddenly. It builds silently day after day, hidden beneath symptoms that seem harmless until it reaches a point where it becomes very difficult to reverse. But here's what most people never hear in time. There are simple, natural ways to reduce that hidden burden on your kidneys if you start early enough. And today I'm going to show you something so simple, so overlooked, that it might already be sitting in your kitchen right now. And what it does inside your body may surprise you more than you expect. Let me be very clear about this. Creatinine is not just a number your doctor mentions in passing. It's a warning sign that your kidneys are already under pressure, struggling to keep up with the waste your body produces every single day. As we age, blood flow to the kidneys naturally declines, and that means toxins begin to build up faster than they can be filtered out quietly, pushing your kidneys closer to overload without you even realizing it. I remember a patient of mine, a 62-year-old man who came in thinking he was just a little tired lately. No pain, no major symptoms, just fatigue and slightly swollen ankles by the end of the day. But when we checked his labs, his creatinine had already crept above the safe range. He was shocked because he felt fine. And that's exactly how kidney damage works. It hides until it doesn't. Now here's where things get interesting. Because green papaya contains natural enzymes like papain, along with soluble fiber that helps shift part of the detox burden away from the kidneys and toward the digestive system. In a study from Kyoto University, older adults who incorporated green papaya into their diet for just 8 weeks showed measurable improvement in kidney filtration markers, along with reduced fatigue and less fluid retention. In simple terms, their bodies started to feel lighter, more balanced, less overwhelmed from the inside out. And if you've ever felt that heaviness, that unexplained tiredness, you might already be closer to this situation than you think. But understanding creatinine is only the beginning, because there's another hidden force silently damaging your kidneys even faster. And most people completely overlook it. And that hidden force is something most people live with every single day without even noticing. Chronic low-grade inflammation. It doesn't scream for attention. It whispers through stiff joints in the morning, a dull ache in your lower back, or that constant feeling of heaviness in your body that never fully goes away. But beneath those small signals, inflammation is quietly damaging tissues, including the delicate filtering units inside your kidneys. I once spoke with a woman in her late 50s who told me, I thought it was just aging. My knees hurt, my back felt tight, I just accepted it. But when we looked deeper, her inflammatory markers were elevated, and so was her kidney strain. These things are not separate. They're connected more than most people realize. This is where green papaya begins to show a different kind of power. Its natural enzyme, papain, has been studied for its ability to break down excess proteins and reduce inflammatory responses in the body. Some clinical findings suggest that reducing inflammation can directly ease the burden on organs, including the kidneys, by lowering the internal stress load they have to process every day. Over time, people often report something simple but powerful. They move easier, wake up with less stiffness, and feel like their body is no longer fighting itself. And if you're feeling that constant tension in your body right now, that's not something to ignore. It may be your body asking for help. But understanding inflammation is still only part of the picture, because there's another silent factor that can damage your kidneys even faster. And it's something millions of people struggle with every single day without realizing the long-term consequences. And that silent factor is high blood pressure, something millions of people live with every day, often without symptoms. Yet it's one of the fastest ways to damage your kidneys without warning. You see, your kidneys are filled with tiny, delicate blood vessels that act like filters. And when blood pressure stays elevated over time, those vessels begin to stiffen, narrow, and eventually lose their ability to function properly. It doesn't happen overnight. It happens quietly, gradually, until filtration slows down and waste starts to accumulate inside your body. I once had a patient, a 65-year-old man, who told me he felt completely normal. No pain, no discomfort, just occasional headaches that he ignored. But when we checked his numbers, his blood pressure had been high for years, and his kidney function had already declined significantly. What shocked him most wasn't the diagnosis. It was how silent it had been all along. And that's the danger. High blood pressure doesn't ask for your attention until real damage has already been done. Now here's where green papaya becomes more than just a food, it becomes part of a strategy. It contains a natural balance of potassium, which helps counteract excess sodium in the body. When sodium levels drop, blood vessels relax, circulation improves, and pressure begins to stabilize. Combined with its soluble fiber, which helps reduce cholesterol buildup, it creates a protective effect for both your heart and your kidneys. Studies have consistently shown that improving potassium intake and reducing sodium can significantly lower blood pressure and slow kidney damage progression. So if you've ever been told your blood pressure is a little high, don't ignore it, because that little can become something much bigger over time. But even controlling blood pressure isn't enough on its own, because there's another everyday problem that quietly increases the workload on your kidneys. And most people think it's completely harmless. And that everyday problem is something so common, so overlooked, that most people never connect it to kidney health at all. Poor digestion. It may not sound serious at first, just a little bloating, occasional constipation, or that heavy feeling after meals, but over time this slows down your body's ability to eliminate waste, forcing your kidneys to work even harder to compensate. What should have been cleared through the digestive system lingers longer in the body, increasing the toxic load your kidneys must filter every single day. I remember a patient in his early 60s who told me he only had bowel movements every 2 to 3 days. He thought it was normal for his age, but he also complained of fatigue, brain fog, and mild swelling. When we improved his digestion simply by adjusting his diet and adding more soluble fiber, something unexpected happened. Not only did his digestion improve, but his energy came back, the swelling reduced, and his kidney markers stabilized over time. It wasn't magic. It was the body finally being allowed to do its job properly. Green papaya plays a key role here. Its enzyme papain helps break down protein more efficiently, reducing the burden on both the stomach and the kidneys. At the same time, its soluble fiber absorbs water, softens stool, and supports smoother bowel movements. Research from Stanford has shown that increasing soluble fiber intake can reduce constipation risk by up to 20%, which directly lowers internal toxin buildup. And when your body eliminates waste more efficiently, your kidneys are no longer carrying the full load alone. But if you think improving digestion is enough to fully protect your kidneys, there's something even more critical happening deeper inside your body. Something that directly affects both your blood and your filtration system in ways most people never see coming. Wait, before we go further, the next 2 factors are where things start to get truly shocking, and most people completely miss them until it's too late. Make sure you stay with me, because what comes next could change how you protect your kidneys for the rest of your life. And that deeper issue begins in a place most people rarely think about: the liver and the level of fat circulating in your blood. Because long before kidney damage becomes visible, excess cholesterol and fat quietly overload the liver, slowing down its ability to filter toxins efficiently. And when the liver falls behind, those toxins don't disappear. They stay in circulation longer, eventually reaching the kidneys and forcing them to work harder than they were ever designed to. I once worked with a 58-year-old patient who didn't have any major symptoms, just slightly elevated cholesterol and occasional fatigue after meals. He assumed it was nothing serious, but over time his blood test revealed a pattern: rising lipid levels, early signs of fatty liver, and a gradual increase in kidney strain. What surprised him most was how connected everything was. Something as common as high cholesterol was quietly affecting multiple organs at once. This is where green papaya becomes a powerful ally. Its soluble fiber binds to bile acids and cholesterol in the digestive tract, helping remove them from the body before they can be reabsorbed. At the same time, antioxidants like vitamin C and beta-carotene help prevent oxidative damage to blood vessels and liver cells. Studies have shown that regular intake of soluble fiber can reduce LDL cholesterol by up to 10%, which directly lowers the burden on both the liver and kidneys. And here's what many people begin to notice first. It's not just better lab results. It's better sleep, lighter digestion, and a clearer, more energized feeling in the morning. That's when you know your body is starting to rebalance from the inside out. But even when your liver and cholesterol are under control, there's another system quietly influencing how well your body can defend itself. And if this system weakens, everything else becomes more vulnerable. And that system is your immune system, something most people don't think about until it starts to fail them. After the age of 55, your immune response naturally weakens. Your body becomes slower at fighting off infections, slower at repairing damage, and more vulnerable to the kind of low-level stress that gradually wears down organs like the kidneys. It's not dramatic, it's not sudden, but over time it changes everything about how your body protects itself. I remember speaking with a patient in her early 60s who told me she kept getting small infections, nothing severe, just recurring colds, urinary discomfort, and constant fatigue that never fully went away. She thought it was just part of getting older. But when we looked deeper, it wasn't just aging. Her immune system was underperforming, and that chronic weakness was adding extra pressure on her kidneys to manage ongoing inflammation and waste. This is where green papaya offers something most people don't expect. It's rich in vitamin C and beta-carotene, two powerful compounds that support immune function and reduce oxidative stress inside the body. These nutrients help neutralize free radicals, protect cells from damage, and allow your body to recover more efficiently. Over time, people often notice fewer infections, better energy, and a stronger sense of resilience, like their body is finally keeping up again. And if your immune system feels like it hasn't been the same lately, that's not something to ignore. It's often a sign your body needs support from within. But even a stronger immune system isn't enough on its own, because there's another hidden factor that can silently accelerate kidney damage faster than almost anything else. And chances are it's already affecting you right now. And that hidden factor is something millions of people deal with every single day: unstable blood sugar. You don't have to be diagnosed with diabetes for this to matter, because even small repeated spikes in blood sugar can quietly damage the tiny filtering units inside your kidneys over time. It's a slow process, almost invisible at first, but each spike creates stress, inflammation, and microscopic injury that builds up day after day until the kidneys begin to lose efficiency. I remember a man in his late 50s who told me, "My doctor said I'm not diabetic yet, so I thought I was fine." But he often felt tired after meals, sometimes dizzy, sometimes unusually sleepy. When we looked closer, his blood sugar wasn't stable, it was fluctuating constantly. And over time, those fluctuations had already started to affect his kidney function. That's the danger. It doesn't have to be extreme to cause damage, it just has to be consistent. This is where green papaya becomes especially valuable. It has a low glycemic load and is rich in soluble fiber, which helps slow down the absorption of sugar into the bloodstream. That means fewer spikes, less pressure on insulin, and more stable energy throughout the day. Research from the University of Queensland suggests that increasing soluble fiber intake can improve insulin sensitivity by up to 15%, which directly reduces the long-term strain on your kidneys. So if you've ever felt that sudden crash after eating, or that lingering fatigue that doesn't quite make sense, it may not be random, it may be your blood sugar sending you a signal. But even when modern science explains these effects, there's something fascinating. Because long before these studies existed, traditional medicine had already described a very similar pattern in a completely different way. And that's where traditional medicine offers a perspective that may surprise you. Because long before lab tests and clinical studies, it was already describing patterns in the body that we're only now beginning to understand scientifically. In traditional Eastern medicine, green papaya is considered a cooling food used to reduce internal heat, ease swelling, support digestion, and improve the flow of energy and blood throughout the body. I once spoke with an older patient who told me that her grandmother used to cook green papaya with fish whenever someone in the family felt heavy or swollen. At the time, she didn't understand why it was just a habit passed down through generations. But years later, when she started experiencing mild swelling in her legs and digestive discomfort, she returned to that same dish. Slowly, she began to feel lighter, less bloated, more comfortable after meals. What she thought was just tradition turned out to have real physiological effects. Modern science now helps explain what traditional medicine observed. The anti-inflammatory compounds, enzymes like papain and soluble fiber in green papaya, all contribute to reducing fluid retention, improving digestion, and easing the overall burden on the body's detox systems. In other words, what traditional medicine calls clearing heat and reducing stagnation, science now describes as reducing inflammation, supporting circulation, and improving metabolic balance. Two different languages, pointing to the same truth. And when both ancient wisdom and modern research begin to align, it's usually a sign that something is worth paying attention to. But here's what many people don't expect. Because while these benefits happen internally, there's another change that often shows up in a much more visible, everyday way, something you notice not in your lab results, but in how clearly you see the world around you. And that visible change often begins with your eyes, something many people don't immediately connect to overall health, yet it can be one of the earliest signs that your body is either supported or slowly declining. Vision doesn't suddenly disappear, it fades gradually. You start needing more light to read, your eyes feel dry or strained, and things just don't look as sharp as they used to. Most people accept this as normal aging, but in many cases, it's also linked to oxidative stress and nutrient deficiency happening deep inside the body. I remember a patient in her early 60s who told me she stopped driving at night because everything looked blurry and uncomfortable. She thought it was just age catching up. But when we adjusted her diet, adding more natural sources of carotenoids like green papaya, something changed. A few months later, she told me, "I don't know what happened, but my eyes just feel clearer." It wasn't a miracle, it was her body finally getting the support it needed. Green papaya contains beta-carotene and lutein, two powerful compounds that help protect the retina and reduce the risk of age-related macular degeneration. Studies have shown that consistent intake of carotenoids can reduce the risk of severe vision decline by up to 30%. These nutrients act like a natural shield, protecting your eyes from oxidative damage and supporting long-term visual clarity. And when your vision improves even slightly, it changes how you live your daily life. You move with more confidence, feel more independent, and engage more fully with the world around you. But here's the part most people never consider. Because beyond what you can see, there are changes happening at a microscopic level inside your body that may be even more important for your long-term health. And that brings us to the final piece. The one most people never expect, yet it may have the biggest impact on your long-term health: what's happening at the cellular level. Because long before any disease is diagnosed, long before symptoms become obvious, your body's constantly dealing with microscopic damage caused by inflammation and oxidative stress. And if that damage isn't controlled, it can create the perfect environment for abnormal cells to grow over time. I once had a patient in his early 60s who told me, "I feel okay, but I worry about what's happening inside that I can't see." And that concern is more valid than most people realize. Because many serious conditions don't start with pain, they start silently at the cellular level, where damage builds up slowly until it reaches a tipping point. This is where green papaya shows one of its most overlooked benefits. Its enzyme papain, along with antioxidants like vitamin C, beta-carotene, and natural plant compounds, helps reduce oxidative stress and support the body's ability to regulate abnormal cell activity. Some laboratory studies have suggested that these compounds may slow the growth of certain abnormal cells and protect DNA from damage. It's not a cure, but it's a form of protection, and sometimes prevention is the most powerful step you can take. And here's why this matters more than anything we've discussed so far. Because when your body is protected at the cellular level, you're not just reducing risk, you're changing the trajectory of your health. You're giving yourself a better chance to avoid the outcomes so many people fear, including the possibility of severe kidney decline that leads to dialysis. So now the question becomes, knowing all of this, will you ignore the signs your body has been quietly sending you? Or will you start making small changes today that could protect your health for years to come? If there's one thing I want you to take away from today, it's this. Your kidneys don't suddenly fail. They slowly lose strength over time, often without pain, without warning, and without a clear signal until the damage has already gone too far. But the good news is you are not powerless. Small, consistent changes like improving your diet, supporting your digestion, managing your blood pressure, and adding simple, natural foods like green papaya can make a real difference in how your body functions every single day. You don't need to wait for a diagnosis to start taking care of yourself. You can begin today right where you are. And if this video helped you understand your body a little better, I want you to do something simple but important. Save this video because you may need to come back to it later, especially when you start making changes step by step. And if you're serious about protecting your kidney health and staying informed, make sure you subscribe to the channel because I'll be sharing the latest medical insights, simple strategies, and practical guidance to help you take control of your health before problems become irreversible. Remember, Juan, your body has an incredible ability to recover when you give it the right support. It's never too late to protect your kidneys, to feel lighter, to sleep better, and to live with more energy and confidence. Start small, stay consistent, and your future self will thank you for it.